probably gives a bit of context in our setting. So basically, we know we have a challenge of access to specialized cardiac services like intervention, surgery. And for example, in Africa, it's estimated that there are only 2,000 cardiologists for the whole of Africa. That's a population of about 1.5 billion. And in Kenya, specifically, we have about one cardiologist for 1 million Kenyans. So that just tells you the kind of health system that we are trying to improve to address this growing burden of cardiovascular diseases. And the other sad thing is that in our setting, our patients are getting cardiovascular diseases earlier, decades earlier. So on average, you'll find the patient with cardiovascular disease is about 50 to 60 years. And this is someone in the very productive age. So I'm just bringing out the fact that we do need prevention programs, both primary, targeting those who don't have CVDs, and secondary, targeting those who already have cardiovascular diseases to make sure they can be rehabilitated back as soon as possible so that they can go back to their activities of daily living. So I just want to add to what Patrick said, that before the COVID pandemic, most of the cardiac rehab programs were center-based. Basically, the patient had to come to a physical location and get their cardiac rehabilitation. And maybe for those who may not know what cardiac rehabilitation is, it's basically a program, medically supervised program, targeting patients who already have cardiovascular diseases or those at risk, helping them to reduce their chances of getting another event and improving their quality of life, improving their functional capacity, and making sure they're able to go back to the activities of daily living. So during the COVID-19 pandemic, of course, it became difficult to access these services, and that's when people started thinking about home-based cardiac rehab and hybrid. Hybrid is where we now combine home-based and center-based. So that's really where technology comes in, because for us to effectively deliver home-based cardiac rehab or hybrid, technology really comes in handy to facilitate remote communication between the patient and the health provider, remote tracking of the vital signs. For example, if the patient is exercising at home, the vital signs are able to be transmitted, and we are able to see if they are safe to continue with the exercise. We can transmit education material through either mobile apps or web platforms, SMS, WhatsApp, social media. So it's been able to really help us deliver care remotely. The other advantage of home-based and hybrid cardiac rehab is its data has shown that they are equally as effective. They are as effective as center-based cardiac rehab, and they could even be more cost-effective because we are reducing the cost of having a physical space, having a lot of equipment, human resource, doctors and physicians, physiotherapists and other, the cardiac rehab team can deliver this care remotely. So we are reducing that human resource burden. So it's really a cost-effective and clinical effective approach. So actually for myself and our organization, as we try and scale up access and availability to cardiac rehab in our setting, we are focusing a lot on these home-based and hybrid solutions because of the advantages that I've talked about.